I'm Cindy Parseghian, the mother of 3 of 4 children who lost their lives to Niemann-Pick Type C disease. Last summer, I was looking for videos for a CNN show on NPC that aired in August. For 2.5 days, I was immersed in my children's lives, my family's journeys through photos and videos. It has been easier over the last 13 years since we lost our last daughter, Marcia, to focus on the laughter, the smiles, the hugs, the love, as opposed to the falls, the choking, the seizures, the pneumonias, the bruises, the tears. In the past, it has helped me to try to glaze over the painful memories of my children's lives and concentrate on their smiles that glisten from their photos. Michael dressed as a cowboy or heading off to karate. Marcia dancing. Christa adorned in purple, her favorite color. It has been a coping mechanism that has allowed me to try to forget the pain my children endured, that all NPC children endure. Thankfully, we have many pain-free, joyful memories of each of our young children, when each child was the most beautiful ever, healthy, alert, with the requisite 10 toes and 10 fingers. Our dreams and hopes for them were boundless. But as the years moved through the videos, the NPC symptoms started creeping in with very many poignant moments. The jagged bob of the head, indicating an eye movement problem, a vertical gaze palsy. The unexplained enlarged spleen, first noticed in 2 of the children when they were toddlers, one as an infant. Their gymnastics coach referred to Michael as Belly Man. The slowing of the speech, the stumbles, the black eyes on Michael after a significant fall. I watched Christa collapsing after laughing too hard from cataplexy. All 3 of our children suffered from cataplexy and grand mal seizures. The seizures started around age 9 and seemed to occur more frequently when the children were tired or suffering from a cold, the flu, or pneumonia. Then there is Marcia, no longer able to stand by herself in her beloved dance class, supported by a friend or being twirled in her wheelchair. There were the mechanical apparatuses that started appearing, the leg braces, the walkers, the wheelchairs, the breathing equipment, the feeding tubes. There were the wonderful and always necessary school aids by the children's sides. Our unaffected son, Era, gently playing, having a pillow fight with his younger brother, being cautious not to hurt him, knowing his 9-year-old brother didn't have the dexterity to protect himself. The picture capturing Christa's spastic toes, one last time, as she lay dying. And Marcia, without her best friends, Michael and Christa, telling me she knew she wouldn't grow up. The videos forced me to relive the horror of watching NPC cruelly steal my children's lives, finally culminating in videos made for their memorial services. Michael died just days before his 10th birthday from a seizure early one morning in his bed. He had started having seizures about 9 months before, but the medications never totally controlled the episodes. A seizure led to his suffocation early one morning in his bed. Michael was the first to show signs of the disease when he was 5-ish. His speech became slow. He couldn't keep up with the other kids on the playground with his stumbles and falls, leading to several trips to the ER for stitches. And he couldn't quite look me in the eye. It would take a 2-year journey through various doctors' offices to finally get a diagnosis. Our youngest, Christa, was the next to die. From birth, she was always more frail than her siblings. By the time she was 2, we knew that whatever Michael had, so did Christa, as her gross motor skills, including jumping and running, were impaired. She struggled with pneumonia for several years. A dear friend described her breathing, due to her scarred lungs, as cooing like a baby dove. At 10 and a half, she could fight no longer. A feeding tube had been inserted 4 months before she died, but it was probably too late to offer her the nutrition she needed to stay strong. She hated the feeding tube, pulling it out several times before she died of pneumonia. Marcia would live until she was 16 and a half. And yes, when you have a child that has a fatal disease, you don't count life in years, you count them in months. Marcia was physically the strongest of our children and the slowest to show symptoms. Her diagnosis came as a surprise. She was the first to skip in her dance class, tie her shoes. She was reading before she entered kindergarten. Yet by the end of 1st grade, she had already fallen academically behind her peers. In a wheelchair by 12, it held her crumbling body, but not her soaring spirit. Maybe she lived to an older age than her siblings because we worked hard to maintain her lung capacity with breathing treatments several times a day, even when she wasn't suffering from pneumonia. Or maybe it was the nutrition through a feeding tube that was inserted when she turned 13. Yet in the end, she too would succumb to pneumonia. Our journey has been one of pain and joy, the pain of losing our child to an insidious, horrible disease, and yet the joy of having him in our hearts forever. Thank you.